the third floor of Mary Birch Hospital, where you come to have babies. This is where our unit clerk sits. This is V, who does all of the paperwork, puts together charts, and takes care of business. So this is one of the mini pods. And this is a Pyxis, which we use our fingerprint, and this is where we get all of our medications. This is a typical labor and delivery room. Baby bed, monitors, patients. This is Ronnie, one of our nurses. Hi, Ronnie.
One of the many procedures that a nurse will perform that patients hate is an IV start. Those are all my IV supplies. This is my patient who has a tourniquet on her arm. This is to help backflow blood into the veins so that they're nice and visual as well as palpable to place a good IV. The IVs are utilized on almost every single patient. They're used for IV hydration as well as to place medications. First part of the procedure is that we do clean it with alcohol. This is to minimize infection. After it is cleansed with alcohol, we will dry it off. Once that's all done, we will utilize a medication called lidocaine. The lidocaine will actually numb the site so the patient will not feel the poke of the larger needle, which is used to introduce the IV catheter. Once the IV is in place, generally we actually draw labs off of the IV site. This is to minimize poking. This is just the lidocaine going into the skin. This is just to numb the spot. This is where patients will feel a poke and then a quick sting like a bee sting. The area will numb actually fairly quickly. On this particular patient, I am using a 20 gauge needle, which is actually a smaller needle than we usually utilize. You'll see that there's a needle that helps introduce a flexible catheter. The catheter is the only thing that stays in the vein. The needle is only utilized to introduce the actual catheter in. So once the needle hits into the vein, we thread the catheter through, then we retract back the needle. So there's no more needle. This is where we draw the labs so that we can send them off to the laboratory. We generally do admission labs on all of our patients as well. And like I said, once it's in place, we will attach the tubing, tape it down really, really well, and then we'll actually sign date and time the actual IV site on the clear plastic Tegaderm that's utilized to anchor it down. And that is an IV start. As a labor and delivery nurse, one of the most important jobs that we have is to assess fetal well-being while patients are in labor. This small screen tells us exactly how baby's doing in utero. When I'm working in labor and delivery as the charge nurse, this is where I sit. I'm responsible for all the patients on the unit as well as all of the nurses on the floor. I'm monitoring fetal well-being as well as keeping track of patient progress. Labor and delivery nurses also assist in cesarean sections in the operating room.
I just can't get the smile off my...
Good job.
5, 6, 7, 8.
Open. Excellent.
Oh my God.
Good job.
The inside of an operating room at a surgical center that specializes in pain management. That is what's called a C-arm. takes x-rays, the OR table, anesthesia cart. This is what's called a sterile field, what's needed for procedure.
Hi, my name is Roxanne. I'm a new grad registered nurse. I just graduated in May 2020 and I went to San Diego State from 2016 through 2020. I was a direct admit. When I applied at 18, I was directly admitted to the nursing program.
So what type of degree do you receive after the 4 years?
So after the 4 years of a university, you get your BSN, which is your Bachelor's of Science in Nursing. And then you take your NCLEX after you get your BSN. So
Can you explain to them what an NCLEX is?
yes, it's the national state board exam, kind of like how doctors take the MCAT and lawyers take the bar exam. Nurses have to take the NCLEX that give you certification of being a registered nurse.
And how hard was it to find a job after passing your NCLEX?
Times have changed, and it's pretty hard to get into a position that you really want. Most nurses who just are newly graduated, they definitely want to go into a new grad residency program, and that's basically in a hospital that's kind of known. They do programs kind of like how doctors have residencies, nurses also have residencies, where it's a period of time where you're learning the hospital's policies, you're learning how your unit kind of works and stuff like that. And so each hospital is different, but it's kind of like a year-long experience, which is nice because you have a preceptor, someone that will help you out, a teacher kind of, and a mentor. It's pretty hard to get into those programs. Yeah.
Any special tips or any advice you could give anyone looking to get into the nursing program or getting a job afterwards?
Yes, get into a hospital, work at a hospital before you graduate nursing school, or become a CNA at a hospital that you really like. That gives you exposure to what the hospital is like, gives you exposure to what the culture is like, also gives you exposure to kind of the policies and everything, so you're not all new when you graduate. So I was a CNA at Sharp, and that kind of helps me out. It gives you exposure to the unit that you're on, but also the managers, networking. It's really important to network. I think no matter how good your grades are, the most important thing is who you know. Especially getting to a new grad program, it's very important to kind of reach out to these leaders, the managers, and the talent recruiters and everything like that. So that's really important. So I think the best way to get in contact and network is to get a job at a hospital as soon as you can. Yeah.
Can you think of anything else?
That's it. It's pretty good. I think going into state, I don't know who would want to go into state or what college this is, or what college you'd be going to, but going to a direct admission college really helps out because you have less competition. But it's a really rewarding job, and yeah, thank you.
Thank you. What type of nursing do you hope to get yourself into?
So right now I'm really used to med-surg, but eventually I really want to try to do either ED or ICU. They're both completely different ends of the spectrum, but I really like both sides, so hopefully I get to experience that.
Can you go ahead and state your name and your position?
Hi, my name is Christian. I'm an X-ray tech, also known as a radiologic technologist. So, yeah.
And how do you become an X-ray tech? What happened after high school?
So after high school, I went to community college for a little bit, did some prerequisites there, and then I got into PIMA Medical Institute, it's called. So it's a 2-year program. and it's a very good program. Not too long, and you can make some good money after.
What type of prerequisites did you do?
I did a lot of biology, medical terminology, a lot of medical classes, different things like that, anatomy, things like that.
And as an x-ray tech, what all do you do?
So I do many different things. I can go many different routes, but I started off just doing regular x-rays, chest x-rays, if you need an x-ray of a broken bone that you hurt. And then you can also go into the OR, so you use a C-arm. It's like a portable x-ray machine. So you help the doctor during surgery, and you show them the inside of the body with the x-ray machine while they're working on the body. You can also go back to school. You can do CT, MRI, ultrasound. So it's a good stepping stone to continue your career in imaging in general.
What's your ideal job using your title?
My ideal job, I would eventually like to get into CT, MRI, go back to school. So right now I'm just starting off X-ray tech, pain management right now. So yeah, hope to continue my career in school.
Do you have any tips or anything to give high school students if they want a career path this way?
Yeah, definitely just decide what you want to do early. You know, you don't want to waste too much time. So just get to school, take some prereqs at least until you figure out what you want to do, and then do it.
So go ahead and tell us your name.
My name's Ethan Jackman, and I'm a scrub tech student. Well, now I'm a scrub tech. I just graduated, sorry.
Just started his first day on his first job. Congratulations. And Ethan, can you explain to us what happens after high school to become a scrub tech?
Well, the steps I took, I just went to, my school was Pima, which is in Chula Vista and San Marcos. And to get enrolled, I basically just went there, showed them my transcripts from high school, and I went straight out of high school, so it's not like you have to wait. And it was about 18 months, but because of COVID, it took a little bit longer for me, but 2 years to have a decent career in the medical field isn't too bad. So it's basically just microbiology, anatomy, physiology, the pharmacology as well, and then I moved off to my internships, finished those, and now I'm at my first job.
Can you explain to them what exactly does a scrub tech do?
The scrub tech, they basically monitor the sterile field, and they open up everything that the surgeon is going to need during the procedure. And in the bigger cases, you're going to be setting up all the instruments, the supplies, even grafts and things of that sort. And you basically just make sure the surgeon has what he needs, he or she, what they need, and basically just make sure the efficiency of the room and the sterility is always top notch.